a common mental disorder. Globally estimated 5.7% of adults suffer from depression. According to reports, more women suffer from depression than men. And to join us to discuss this topic is Dr. Olusegun Shoyimbo. He is a consultant psychiatric at the National Hospital. But before we call the doctor, let me say hello to my ladies in the house. Fatima and Zuleha, good morning.
Good morning.
Good morning.
Good morning.
Many thanks for joining me.
Thanks to you too.
Okay. So we're discussing a topic that touches everybody one way or the other. Maybe at a point all of us get depressed and we don't even know. But let's speak to the expert first, and then we can now go into yes. We'll take a break, and when we come back, Dr. Shoyimbo will be joining us after the break. Dr. Shagun, good morning.
Good morning.
All right, welcome to the program, The Voices.
Thank you for having me.
Okay. Dr. Shagun, just how bad is depression?
Depression is a medical condition. It can have associated symptoms like poor appetite, poor sleep, and when depression gets very severe, it can have complications like thoughts of self-harm, and people can die from suicide. How bad then is
I'm asking
depression?
you how bad
Depression
because
is bad.
Can you hear me? Because globally, according to the World Health Organization, 5.7% of adults suffer from depression.
Okay.
Yes, and that.
So are you asking how bad or how common is it?
No, how bad is it? How bad?
So again, depression has severity. Somebody can have mild depression, somebody can have moderate depression, and somebody can have severe depression. In the severest form, depression is as bad as who has very poorly controlled diabetes or hypertension. So it can be that incapacitating, because if somebody has depression and does not feel like getting out of bed, taking a shower, eating food, talking to anybody, the person cannot go to work. I think that is severe, and it gets more severe if the person can start having severe thoughts of harming themselves, or if their depression is complicated by unusual experiences. Maybe they now hear a voice telling them they are evil, or they are bad, or that they should go and jump, or something like that.
Okay.
Then you see how it can be very severe.
Okay. I'm sure the ladies have a number of questions for you. Yes.
Yeah. Good morning, Dr. Shagun. So
Good morning.
we know many families, they struggle to understand mental health problems, including depression. How can we recognize early signs of depression?
So again, I'll go over the symptoms again. One of the things I like to say to people is one of the early signs of depression is that there will be a change in the person's behavior. The person will lose their charm and color. Life becomes bleak. Okay? The person can appear to be lazy. So your subordinate or your family member who suddenly is not able to turn in his assignments or submit tasks at work, when in the past they used to, the person might just be having depressive symptoms, because when people are depressed, they feel lethargic. They don't have energy. Even to wake up and take a shower and change their clothes becomes a problem. When people are depressed, they lose interest in things they previously found pleasurable. So somebody who used to love to pray or to play sports or watch TV, read books, suddenly doesn't find all those things interesting. When they are married or they are sexually active, they may have absolutely no interest in sexual activity. So low libido can be a symptom of depression. Poor appetite, they might lose interest in food. In some cases, they might begin to eat excessively because they find comfort in food, which then makes them gain weight, and then they feel sad that they have gained weight, and then they eat more, and then they gain more weight. So, but one of the things that we should be very careful about is when people begin to make certain bleak statements that we tend to dismiss. When somebody begins to say, oh, this life is not worth living, or for somebody who's a Christian, they might even quote scripture and say, this life, vanity upon vanity, all is vanity. And we think the person is supposed to scripture, but the person is actually expressing the dark side of their mood. These are some of the things that we can see in people that do. This person might be suffering from depression.
So I'm sorry. Let me.
It may have times, or sometimes in women, but mostly in men, it might present as very irritable mood, anger, outburst, fighting. Everything catches fire around the person. Okay, that's why on the road it is two men you see fighting. You don't see two women fighting that you scratch my car.
So other behaviors people usually dismiss as normal mood swings, but are actually red flags of depression.
So we are human beings and we have emotional responses. Sometimes sadness is pervasive. The person remains unhappy for a period. Even when things happen that should make the person happy, the person can be unhappy. For the normal mood responses, you can be sad in the evening if they beat your football team, and then by morning salary hits your account, you are happy. But for a depressed person, you will see that the mood is, let's pick something peculiar to women. For example, you must have heard of postpartum depression. We all know that having a child is supposedly sad. So that's what can happen in depression. So that joyful, even when you have situations that somebody has an emotional response, it's not there. So to summarize this point, it is to say that the sadness is pervasive and the mood doesn't respond to things that would usually lift the mood up.
Dr. Shagun, do people, sometimes the symptoms you talked about, even if you have malaria, severe malaria, it can make you display those kind of behavior, loss of appetite, anger, losing interest, being weak, and all of that. Do we sometimes mistaking a common malaria symptom for depression?
Not quite. So depression would usually not come with some of those things like fever, general body pains, bitter taste in the mouth, and things like that. However, in the early stages of depression, a person can begin to feel quite unwell. They are tired and they don't know why they are tired, and so they keep going from one hospital to the other, doing one test after the other. They are looking for answers. They want to understand what is going on with them. And usually in our environment, if you go to 10 labs, most likely now will tell you you have malaria and typhoid, and people keep treating malaria and typhoid. So sometimes they point out to the doctor to say, look, seek psychological help. Is that somebody has been going to hospital frequently and they've not found any explanation for the symptoms the person is having, maybe other than malaria and typhoid. Yeah.
Okay. Zuleha?
I think you have already asked most of the questions that I have for him. Good morning, Dr. Shagun.
Good morning.
As a lady, or rather as a woman, as you said, there are a lot of depression symptoms that we might display sometimes as women. We have these mood swings, which people oftenly mistaken them for depression symptoms. So how do you specifically distinguish between mood swing, normal mood swing, and not normal mood swings with depression? How do you specifically, is there like a screening or a test, or how do you, because sometimes when someone is moody and sometimes they tend to utter some words that sounds so depressing. So how do you distinguish that from normal mood swing and depression?
Okay, so again, we are very careful in saying these things publicly so that everybody does not begin to make diagnosis of their neighbors and brothers and sisters. But we also want people to be able to recognize these things when they see them. Number one, we are human beings and we have emotional responses. I'm repeating myself. It's not every time somebody is sad that it means that the person is depressed. For example, if somebody is bereaved, it is not unexpected that the person would be sad. Somebody who has lost a parent or a spouse or a friend and is crying and is unable to sleep, that is not unexpected for a few days. However, eventually we expect that the mood would lift. Take, for example, in our own culture here, somebody loses a parent and the parent is quite elderly. Yes, they will still be sad that they've lost a parent, and at the funeral they are crying, but at the reception immediately after the funeral they are dancing. Abi?
Yes.
So we cannot say that person is depressed. However, for that person to continue to feel down and sad for onwards of 2 weeks, 3 weeks, and it begins to affect the person's functioning, the person can't eat, the person can't sleep, the person can't go to work, etc. We say that this person is now depressed. So it's a clinical diagnosis. It might not be very easy for the layman on the street. We don't even want the layman on the street to make that diagnosis. We just want those who are listening to us now to be able to pick it and point the person in the direction of help. To say, Oga, I saw you crying every day. You are bending your head on the table. You are crying. You are locking yourself in the room. You stop looking after yourself. You are not dressing well, etc. Don't you think you should talk to a doctor? Don't tell the person, I think you have depression. People be thinking that somebody's depression is just to say, don't you think you should talk to a doctor or a counselor or somebody and let them see if they can help you? That's what's more important.
So is there like an emergency help for the early symptoms of depression, like maybe change of lifestyle or food or anything that you can help someone that you think might be going through depression? Is there like something you can help them, like emergency remedies?
Well, I won't call them emergency remedies. We call them things that are helpful generally for both our physical health and example is free and cheap. If you just take a walk in your neighborhood 30 minutes to an hour every day in the early morning sunlight or late evening sunlight before the sun goes down completely, that is very healthy. If you be mindful to sleep well, attempt to catch 6 to 8 hours of sleep rather than stay up and scroll on the phone all night. So that would be considered healthy. If you would stay away from harmful substances, alcohol, cannabis, and all the other drugs that people abuse, that would be something that helps to keep us healthy and keep us away from depression. Note that irrespective of all of these things, people will still have depression. Sometimes depression is not always due to adverse life events. That's what we call endogenous depression. It is not a reaction to a breakup or divorce or loss of a job. Some people in the most fantastic of life situations can still be depressed. However, like I was saying, we should all attempt to maintain healthy lifestyles, sleep well, exercise, healthy diet, reduce exposure to harmful news and events, stop scrolling endlessly and mindlessly on the phone, pick on healthier diet, healthier habits, play sports, interact with people. Social interaction. One of the things that lead to depression is social isolation. When people are in a place where they feel completely different and they cannot relate to the people around them, they are locked up in their rooms all the time, then they can have depression.
So can depression be hereditary?
Like many other illnesses, yes, depression can run in families.
Okay.
We say this with a very deep sense of responsibility. It doesn't mean if you want to marry, you go and check whether they have depression in that family. That is not how it works.
Okay.
Somebody can be depressed. It doesn't mean all his children will have depression. Just the same way somebody can have hypertension and it doesn't mean all his children will have hypertension. It is usually an interplay between genetic factors and environmental factors.
Dr. Shagun,
But
does
to say that
accepting our reality a depression?
Pardon?
I said accepting our reality. Is it a depression in itself?
Yeah.
Can you hear me?
It is not. It is even, in fact, one of the ways to cope with difficulties. When you accept your reality and then begin to find a way to cope with it. If the reality is that I can no longer mount, then I have to go and look to live in a place that costs me power less. If the reality is in itself, it's not bringing down my pressure, it's livable, and it's not within my to deal with difficulties. It is the denying of the reality that puts us at greater risk of depressive illnesses and indeed other illnesses.
Okay, in Africa, where depression, sometimes the severe one, is associated with spiritual problem. What exactly will you be telling those kind of people who will chain somebody, beat him endlessly, and take him to prayer houses where they inflict so much pain on that person? What exactly will you be telling those kind of people in the Africa setting where depression is associated with madness or spiritual problem?
What I tell them all the time is that we are not in competition with the spiritual healers. If somebody thinks that their illness needs prayer, they should by all means pray, but they should also take medical treatment. If somebody is in labor, the nurses, the midwives and doctors are attending to her in the labor room, but I'm sure that woman's mother is also praying outside. When the baby comes out and the mother is well, who do we give credit to? The praying mother or the doctors and midwives? I think it's to everybody, and then we all thank God. In hospital we treat, it is God that does the healing. So nobody should be subjected to dehumanizing conditions in the name of treatment. Tied, beaten, abused. No, that's not the way to treat mental illnesses. Everybody should have access to proper health care. But because in this part of the world we are people of faith, in fact, being a person of faith helps in recovery from depression and other mental illnesses. So we are not against it. We just do not think that they also should be against medical treatment. And I'm talking about prayer. We are clearly firmly against tying people and beating them and dehumanizing them, so that I'm not misquoted.
Quickly before we let you go, Dr. Shego, I just have a question. There are sometimes they be like there are some medical, or should I say mental health issues that is in one that are usually or mostly dormant until maybe there's a trigger. So can depression serve as a trigger? Let's say, for example, someone who has a dormant bipolar disease for a very long time, let's say since birth, and then goes through depression. Can that depression actually awaken that bipolar disease that has been dormant for a long time?
This is a very technical and over-syllabus question. This one is a jam question. But
that's why you are here.
I will remove my way out of it. Sometimes the answer actually will be that diagnosis evolves.
Yeah.
So bipolar is an illness that has depression as a component of it. Okay. So somebody can be having depression and we're making diagnosis of depression. Then when we have the other side, what we call mania, we now realize that, what this person has been having is actually bipolar disorder. It's not that we were in error. It's just that it didn't manifest the other side that would make us make a diagnosis of bipolar. So that remember that this illnesses is not about taking blood test or doing brain scan that will make the diagnosis. It's actually a function of evaluating the symptoms that the patient has presented with. Okay, whether one thing is dormant or not dormant, I don't know. What I will tell you is that illnesses can evolve. Sometimes you treat an illness, it unmasks, and then you see the real underlying problem that you should be treating. Yeah.
So quickly, can you actually tell us what this bipolar is? I think many people have been
mistaking bipolar
for depression. Somebody will tell you, I am bipolar. Or maybe when somebody is having mood swing, they will tell you, I am bipolar. So I don't know, maybe because of the literal explanation. In literature we have what we call is it innuendo or something like that, where you be like, maybe when you see someone who is having multiple moods, so you be like, oh,
Multiple
you're bipolar.
personality disorder.
Yeah.
yes.
So is it that we want to actually know what this bipolar disorder is? So we'll be able
And how
to
different is
how
it from
different
depression?
from depression, exactly, and mood swings.
Well, now you have changed the subject and we have moved to another chapter.
No, we didn't change the subject. We want to get clarity.
Bipolar is a completely different illness and a discussion for another day. But in summary, for those who did geography, they will remember that the globe has a north pole and a south pole.
Yes.
And the middle of it is called the equator. Let us take the equator as a normal mood. Let us take the South Pole as depression, where a person feels sad, unworthy, feels crying, feels like dying. Okay? Now, the upper side, which is the North Pole, is what we call mania. It is the opposite of depression. The person now feels, I am depressed, I am the king of the world. I am the owner of the stadium. My father is the owner of the airport. I have $200 trillion in World Bank.
That's grandiose delusion, right?
The person has an expansive mood. He has feelings of elevated self-worth, decreased need for sleep. He feels so fantastic. His mood is irritable. If you oppose him, he gets very agitated. That is mania. Now, an illness where somebody can have depression today, mania tomorrow, mania next month, another depression next year, that illness is called bipolar disorder. The discussion we're having about depression is actually what we call unipolar depression. Unipolar, bipolar. So somebody can have depression as part of a bipolar illness. It's different from somebody who has unipolar depression. So I'll give you a certificate now that you have completed the course in bipolar.
Thank you so much.
All right, Dr. Dego, finally, what would be your advice to people before they get into severe depression? Aside from, seeing a doctor, what exactly should people avoid?
Well, my advice is if anybody has symptoms that they are uncertain of, that they are unclear about, they should see a doctor for evaluation. Early treatment brings better outcomes. Sometimes the patient himself might not realize that things are not quite well, or might not realize how unwell they are. It might be the people around them who need to point out to them, see, you are beginning to do like this, or we are beginning to notice these deficiencies. Why don't you get an evaluation? My advice to everybody is that we should not be resistant. When they tell you have malaria, you don't say, oh, I reject it by fire. So why do people reject diagnosis of depression by fire? It's better to acknowledge a problem and get help than to suffer in silence.
But Dr. Shaku, can I just walk to a pharmacy or to a chemist and say, please, I think my mood has changed. I need drugs to calm me down. Can I do that?
You shouldn't even walk to a chemist and say you want to treat malaria. The chemist is there to dispense a drug that has been prescribed after a doctor has evaluated you. Okay? So we need to be careful about this behavior of just walking to a drugstore and people give you concoction, mix white vitamin C and pink vitamin C with you and add a little paracetamol and antibiotics. No. This diagnosis is made by people who are trained to do so. There's a reason why people specialize. There's a reason why you take a child to see a pediatrician, you take somebody to see a cardiologist and things like that, so that you get the proper treatment. Now, when you go to a hospital, of course, the hospital is registered, and you take it that the person sitting behind the desk attending to you is qualified to do so. When you go to a drugstore and everybody is wearing a white coat behind the kiosk, including the pharmacist and the sales girl, who do you know you are talking to?
Maybe you're even talking to a more depressed person than you in most cases. Yeah. Do we have enough psychiatric doctors to handle cases of depression?
I was going to say you said finally, but this is a very beautiful question, so I will answer it.
Thank you, sir.
No, we do not have. We are grossly understaffed. A lot of the people that are being trained are jackpying overseas, and you people are encouraging your relations to all travel.
No,
I don't know.
no, we discouraged it. Even yesterday on this program, we discouraged it.
So please continue to discourage it and encourage our people to stay and treat our own people, and encourage government to give proper compensation so that it is worth our while when we stay back. We do not have enough. We have less than 300 psychiatrists to this population of 200 million people.
Wow. Grossly on that.
And that is why I cannot be in the studio with you, because I am here in clinic attending to patients.
Okay.
And your audience includes 3 people sitting in front of me that I was consulting, and our consultation was interrupted by your call. That is how short we are.
Okay. And in addition, we should allow our children to read psychiatry. To study psychiatry.
Yes, when your child studies medicine and says wants to specialize in psychiatry, you say, out of all specialty psychiatry you want to do. It's a very good field, and we need more of us.
All right. Dr. Olusegun Soyombo, consultant, Psychiatric National Hospital. Many thanks, sir, for your time.
Thank you for having me.
And we do hope to see you in the studio one of these days.
Hopefully.
Yes, and the government will have to be paying you 1 million in a month as your salary.
That's too small.
It's too small.
That's exactly what I said.
Let's start from there.
All right.
Thank you very much, sir.
Thank you.
Thank you, sir.
All right. Bye.
All right. And that's Dr. Segun Soyombo, who is a consultant psychiatric at the National Hospital. So he has been able to break it down for us. But let's go to the normal
into depression.
The depression.
No, not us going into depression, but let's go deep into the discussion of depression.
Yes,
exactly.
Yes.
As in, all of us, maybe at a point we are depressed and we don't even know.
Well,
Do you
as
understand?
he says, we are trying to distinguish between normal
not normal.
and depression. No, we
Yeah.
are not depressed, and we will never be by God's grace.
No,
but
because when
the
you hear
problem
the
is-
symptoms,
almost
loss of
everyone
appetite,
goes through that
yes,
kind of symptoms.
and
But-
endless
but-
sleep.
but
I mean, no sleep at all.
I feel like
Uh,
truly it's maybe we haven't really discussed it to an extent. And sometimes when you go through a kind of loss, you can actually go through depression, even you knowing that you are actually depressed. Okay, from a personal experience, I think I've
Sometimes
gone
we
through-
misuse the word depression.
No, I'm serious.
We do misuse the
No,
word
no.
How
depression.
do we misuse it?
For instance, now, okay, I'm tired, I'm hungry, at the same time, I'm exhausted. Someone can just say, I'm really depressed. Using the word depression is actually is like the word depression. The depression itself is really deep. It's truly deep.
It is deep.
When I don't have money in my pocket.
No, you can't say that depression.
No,
You can't call that really
But
depression.
for someone who is
people-
going through poverty and all that,
Hopelessness.
hopelessness.
the person is already depressed. His one is even higher.
Not really. He hasn't been diagnosed with depression.
But he knows deep
They
down
have
that
to be
he's
some,
depressed.
as doctor says, you
There
have
has
to
to
be
be
diagnosed.
the
That you have to be
But you
evaluated
know that,
and then know
just
that
like
okay,
I
I'm
was saying,
depressed, you're
Zulekha,
depressed.
what I was saying is that sometimes when you go through some things in life, you actually know that you are depressed.
You're sad.
You're depressed.
I think we're mistaking sadness for him.
Yeah, exactly. That is
Yeah.
it.
Have you seen
Exactly.
people walking on the street
Yes.
because of economic situation and
Exactly.
they're talking to themselves?
That is not
Yeah, I've
really.
seen
It's
many.
not actually depression. You understand? Depression has
Maybe
more
that can even be the
deeper meaning
bipolar.
than it can be bipolar. It can exactly.
When
Like,
people start talking.
I think we should discuss about bipolar someday,
Yeah,
because
yes.
bipolar itself is another topic, a whole topic on its
yes,
own,
like you
because
said.
it's linked to depression. Well, depression, sometimes sadness, a very severe
Excessive sadness.
excessive
If there's
sadness,
any word
severe
like that.
condition situation
Yeah.
might put you into depression. It might, but it's not necessarily has to put you into depression, but it might put you into depression, because this depression, as he says, because I had to ask this question because I've seen a lot of people that have you might think that there's no person that you say has no problem, but you might think they have no problem, but they are actually depressed. they have all the symptoms, all the signs, and have been diagnosed with depression. But that does not mean that they are not happy. As he says, some might even be happier than than we are. But I think there is hereditary. Some people inherit this depression.
There are so many factors: economic situation, divorce,
factors, like exactly. And this postpartum depression, particularly postpartum depression, which is linked to women. Some people get this depression after childbirth. Yes, after childbirth.
You know, childbirth is a whole world.
It's a trauma. It's traumatic.
There are so many things. Okay, I know we've left depression, but I know of a woman. She has given birth to 3 kids and she has lost 5 teeth rather.
Yes.
Why? Each pregnancy she loses one.
There are levels like that.
Three kids, no 5 teeth. So each pregnancy she loses 1 teeth. It's just so I feel like pregnancy and childbirth
comes with a lot of
package. So
whether good or bad,
the good, the bad, and the ugly.
so you have to manage the package.
And now imagine after going all through that, and at the end of the day you don't get to hold the baby. You want to tell me that somebody will not fall into depression? These are the kind of things I want you to look at. That even yourself will know that.
Now in African settings, he talked about talk therapy and talk to people, tell them your problem. In African setting, you begin to tell people, oh, this, oh, that, and then mistaking you, are you going...
It's another sign of depression.
No, and what I'm saying is that the person listening to you on the other side, who doesn't understand depression, who doesn't understand that it's the medical, problem, that if you do ABCD, you get yourself out of it. And he begins to see you as if, you're going... You're
even talking about going nuts. I'm talking about when you're trying to tell somebody your problem and then they make it the order of the day.
Or they say, are you the first person?
Are you the first person?
You're not the first person.
I feel like many people...
They say, are you the first person to lose a child? I've lost like 5. That's what you hear.
You don't tell me how to hold my grief. That's just it.
Depression
and what I'm trying to say is, when you tell people your problem, do you understand? They make it to be the topic of discussion or a laughing stock. So mostly it's hard for people to talk to another person about the problems they're going through because they feel like, oh, when you tell them, oh, I'm going through this, I'm going through that, and they feel like they sympathize with you in front of you. Immediately you're going, they clap your hands and be like, look at her, she has not even seen anything. Or they'll be like, you don't even know what happened to this person. You don't even know what happened to this person. And before you know, somebody that you feel like you're open to, somebody that you feel like is feeling for you and sympathizing with you because of the problems you're having, you're not hearing your stories outside, washing your dirty linings outside for everyone to see. At the end of the day, you will tell me that the person will not spiral deeper into the depression than the way the person is before?
With companions like Nigerians, I don't think we will fall into depression because whenever you go, if you have a data, you go on social media. Yes. But on a serious note, this depression issue has been, underplayed and has been underlooked into because this situation, when you go to psychiatric hospitals, mainly women, as we are talking about too many women in depression, when you go to psychiatric hospital, you will see most of their patients are women. And these women, it's not just a marital issue or social issue. We have a lot of, I think, our hormones contribute to this depression.
We are naturally
emotional, and sometimes we find it really difficult to suppress our feelings or our emotions. So, and we find it really difficult to find someone to trust and talk to. You understand? Because men, I think they talk things out and they leave it there. But women, when we talk things out with other women, thinking that we have emotional support with those women, sometimes we ended up being deceived or maybe
like
being,
what she said, that
and then people make tend to mock you with that, and then you feel like, okay, I don't have to discuss this with any other person. I just have to keep it to myself because this, and keeping things to yourself really ignites this depression. So once you have someone to talk to, and then you feel okay, deceived, okay, this person has disappointed me, and then sharing my, you know, my problems with other people, and you feel insecure, and then you start, you know, holding your informations, holding all your problems to yourself, trying to navigate your way alone. I think this is mainly the reason why so many women are in the psychiatric now. And sometimes when you're going into marital problems, you try to talk to your parents, even at home.
Yes.
You try to talk to your parents, and those parents will be the same people that will, okay, you are a woman, you have to be patient, you have to do this, you have to do that. Especially in our community, in our Hausa community, in our northern community, you understand? In the northern community, a lot of women go into depression because they have no parental support or family support or guide. Because when you're taking a lady to her husband's house, she's the only person that will be, you know, giving advice to stay with your husband, do this, be the perfect woman.
Be the perfect.
You hardly see the man. You hardly see a situation whereby the man is being seated and then being talked to. Okay, this is how you are going to treat your wife. This is how you are going to do this. This is how you are going to do that. So that irresponsibility in so many cases leads men to pushing women into depression. And I'm not trying to take any side here, but I'm trying to
let's call a spade a spade.
Exactly.
In the northern part of the country, the main cause of depression is marriages. Either broken
marriages
or
trying to piece together,
or try to manage a situation.
Exactly.
Just like you painted it. The young girl or the young woman or whoever it is being, you know,
you have to be patient.
You have to be good. You have to take care of your husband. But nobody tells the man
all right.
be responsible.
Exactly.
Nobody tells the man to be responsible.
Like we said, it takes two to tango.
You say tango. We are
Exactly.
saying tango.
It takes two to tango.
Yeah. But let's begin to look at how do we change this mindset where people cannot even discuss their problems because the African setting or the Nigerian setting, the culture itself, forbids you to say certain things. There are certain things that people
that you
go
cannot
through,
say.
but because of the stigma that is attached, to it. For instance, somebody has a health issue where maybe she can't even, have sex with the husband, and he is not willing to tell anybody, and that has even, put them apart. And she's going through that, and she cannot even tell her own parents or even her close friends because there's a stigma
behind it.
Stigma behind it, because if that marriage breaks up, then the story will be like, don't even go there because she cannot fulfill her marital duty.
Yeah.
So, but how do we wriggle ourselves out of that?
Talking about stigma.
To say, tell your problem as it is. No hold back.
I don't think we are there yet, but we will be there. Still, slowly but steady. But talking about stigma, let me not forget this point. Actually, so many people are avoiding seeing a doctor.
Yes.
Because they don't want to be related to any mental issue. Exactly.
Yeah.
So some people are going into depression, and then they don't want to seek professional help because they don't want to be associated to madness. You understand? But depression is not madness. It is a psychiatric problem. It is a mental illness disorder, but it's not madness. It's not madness. But once you allow it grow and grow and grow, it will turn to madness.
If I remember when we were in school, we had this guidance counseling unit.
Exactly.
But that unit was supposed to help you solve
problems. Yes.
And I don't know if they still have it in schools now.
They do.
In those days, even
there
if
are
you
courses nowadays. There are courses, guidance and counseling.
Then
there is a guidance and counselor.
Yes,
there is a counselor
that you can go to, even if you have problem with maybe your parents are not,
maybe for the choice of study, maybe you want to study this, and
you have a home that is very chaotic. There are homes where the
some
father and the mother are always
exactly.
Fighting and beating each other.
I feel
do we still have those kind of
in Nigeria here, even when I was in secondary school, we had this guidance and counseling. Well, it do help you, but there's something that happened during my secondary school days, and many people
Sorry, I'm
discourage.
asking because there's even depression in children.
Yes,
Yes,
there is.
exactly.
Yeah.
So there's something that usually happen during that time.
Mm.
So it discourages us learners to go to the guardians and counseling
What
units.
exactly happened?
One thing is, when you go there with your problem,
Mm.
as you reach there, you tell them, "Oh, this is this, this is that." The first thing is the whole. Let's say, for example, there was a kid, not in my class. So her home was chaotic. I think her parents were having this marital issues. So it's hard. It was hard for her to concentrate in school, and then, you know how chaotic it can be in a child's head when the home is not at peace. So she was failing because the girl was actually doing well. So she was failing, and then teachers started asking what was the problem. So somebody advised that she should go to the GNC, because if she doesn't want to talk to anybody, she can go to the GNC and talk to the person. So when she went to GNC, she talked to them. They asked her some questions, and then she decided to relate what has been going on. The next thing, she's seen her parents in school. Do you understand? And it became a chaotic something. The parents were blaming her. I think at the end of the day, the parents finally went their separate ways. And before then,
Which
the
you
parents,
feel like she's the cause
yes,
of that.
of course.
And
so
it's going
before
to,
then, teachers would look at her with pity when she's walking by. She whispers. At the end of the day, I think the teachers
started
spoke to
blaming
some,
her.
because we're in a boarding school. The teachers were now like speaking to the matrons and the hostel. It was a lot. And then our D&C, baby, they use it for like corporal punishment and all that. So it kind of discouraged students from going to G&C, because to talk about their problems. But one thing I want to say is that as adults, I always encourage people to go and see a psychologist. I don't know,
A psychiatrist.
no, there's a difference. There's a difference.
If you have depression, you go to a psychiatric.
But I'm not even just talking about depression.
Okay.
I feel like we should encourage people to
To
talk
go
to a psychologist more
Do we
to
have
help
enough?
you.
Enough?
That's the problem. We
Yeah.
don't have enough. But I feel like if you can't talk to somebody, if you feel like you can't talk to somebody close to you, you should actually talk to a professional. And they should create more platforms where we can actually, there's no need for you to meet them in their office. You can actually create an appointment. Technology has made everything very easy.
Easy,
these days.
yes.
You could talk via WhatsApp call. You could talk through a video call. You just need somebody to vent to, right? Just vent to that person.
now you can even record on your phone and then
send.
No,
So
sometimes
platforms
delete
like
or
that
keep
should
it.
be
No,
created.
sometimes
Okay, you need
one-on-one.
response for the
One-on-one
response.
response.
Yes,
You understand? So I have this thing that I do. I don't know. I spoke to a professional because about 3 years back or 2 years back, I went through some rough patches, but that's by the way. So I did speak to a professional, and I thank God I'm healed to an extent. But what I do now, I was advised by the psychologist, not a psychiatrist, a psychologist, that I'm not trying to stigmatize this. I'm just saying that this is the person I talk to. So because of that, I got an advice. So I write a letter to myself every day. It's like a diary, but not really a diary. It's like, okay, these are the things that went wrong today. These are the things that went right. So for the things that went wrong, these are the things that I can do to make it better,
To correct it.
So at the end of the day, before I do compile them, at the end of the month or week, I send it to him. He goes over it, and then we talk more. But these days, I think our session has ended, so there's no need for me to report back to him. But I still continue with that culture because it makes me to have that word affirmation.
Okay.
So I might not call
So
myself
you're self-regulating.
Yes, self-regulating. So I might not call myself a victim of a depression, but I can
But you
also
think.
But I know
So that you don't even fall into it.
I don't want to fall into it, but I know that I have gone through something like similar to that, and I will not tell you that I didn't go through. I'm open about it. So I can actually. So when I
And
see
I think, but
somebody,
that's the spirit where you acknowledge a problem.
yes,
And you know there will be a solution at the end of the day. The reason why people go deeper into depression is because they don't say it out.
yes,
We had a friend that we wanted to talk on
yes,
this program.
yes,
And because you feel feel okay stigma as if what I'm going through is not enough. You
No,
want to add
add
sore
to
upon
it,
it.
yes.
So women need to take the bull
By
by
the
the
horn.
horn. Whatever you are going through, you need to speak to somebody. Yes, you can't speak
out.
to everybody,
Not everybody.
but you need to get a psychologist, even if you don't want a psychiatric.
Yes.
You can go to a psychology and say, please,
I need to talk to somebody.
For people that cannot afford to see a psychiatrist or a psychologist, I think there are other ways that you can.
I don't think it's
resolve that.
expensive. I
No,
don't think.
for people,
Like
some
general
people,
hospitals. I don't.
some people naturally don't like going to the hospitals. They don't like going to the hospitals. They don't like the procedures. They
I
don't
don't
like the
even like.
processes.
I don't like going to
Exactly.
the hospital.
People, I'm talking about myself, but I'm using myself as some people.
I don't.
So
the
if you
procedure
cannot
sometimes
exactly,
is
if you
too
cannot, speak out, okay, or rather go to the hospital and see a psychiatrist or a psychologist or a shrink or whatever it's called,
You
can
actually find it
and if you
offensive when
cannot,
you call them a shrink.
no, they don't.
I think I met one
Okay.
that found it offensive when
To
you
call
call
them
them
a shrink?
shrinks. Yes.
Well, it's just a slang. It's just a slang.
Just call them by their
Yes,
names.
yes, it's just a slang.
Okay.
A mentally health doctor.
Yeah.
I think you can find a trustworthy person, someone that you think you can trust. You don't need to spill out everything. You don't need to spill out everything, but
So you
you
can
need
give
to
them an expo.
exactly an expo. You can ask, or you can even give an example. Okay, my friend needs an advice. So find someone that speaks well
But where
and
does
talks
the
well.
religious body come in? Because people are very comfortable with their religious
Spiritual
leaders,
leaders.
especially
Exactly.
their imams
Exactly.
or their pastors, and then they even have mommy pastors.
talk with them. Yes,
they have
exactly.
a lot of people.
So there are a lot of people like that that you can
where
trust.
where is the religious body in all of this? Shouldn't they be playing a higher role so that if
Okay,
people can't
I'm
go
talking
because
about-
psychiatric
I'm talking
or
about-
psychologists, they can easily go to their religious leaders and say, I need to talk
to you on
Yeah.
on something. I there is this advice that I keep giving people, and I use that on myself too.
Okay.
But I'm not going to say this because I'm trying to restrict it to a particular religion.
Yeah.
But as a Muslim, I'm giving an example based on
Okay.
Islam. There are so many surahs and ayahs that you can read for depression.
Okay.
There are some tasbihs that you can do, and it calms you down.
Yes.
Even if it is psychological, I mean, it helps. So there are some things that you can do to yourself.
Can you share it so that somebody that is
Yes,
listening to you,
maybe it might be a topic for another day.
no,
But
no,
now,
no, already.
no,
yeah.
right now
You
you
just
can
tell
do.
us.
There's so many tasbihs that you can do. As if you're a Muslim, there are some you can do istighfars,
Yeah.
and they calms you down. And even if you're, it works for me. It really works for me. This works for me.
That's where I'm coming to. Yeah.
If I'm broke,
Yeah.
I can never be totally broke.
Okay.
Like if
Something
I'm broke,
will happen.
exactly, something must happen. Like something must happen.
Yeah.
This is the fate that I have. If I am broke, I feel like, okay, I don't have money, and I'm feeling like I'm depressed.
Yes.
Anytime
Anytime I don't have money, no, but let me tell
yes,
you, anytime I
makes
don't
you
have
feel
money, I'm
depressed.
depressed.
Like I
Exactly,
become
I'm
sad,
depressed.
I become isolated,
isolated.
things like that. So what
I
I do
will lose
is
my appetite.
I use my fingers, or use my rosaries, or use my counters.
Yeah.
I do my husband Allah wa ni'mal wakil, and it worked like magic. This really works like magic. But we are not trying to do any spiritual promotion here.
Yeah.
But this is what I do for myself. And sometimes I have a few people that I talk to, although I don't say everything, but I say a little things that I need. And I don't talk to people that I know that I'm not going to get what I want. What I want is, I want someone that will calm me. If I'm angry, someone that will tell me to be patient, and then tell me the virtue of being patient, and this and that, the benefits. I don't want to talk to someone that will say, don't you let this, do that.
Yeah,
You understand? I want someone that will calm me, someone that will tell me words of encouragement, someone that will encourage me. I have a lot of people like that, but I pick a few that I really trusted, and I talk to them. Even if I have problem with someone that I can that's supposed to be my emotional supporter. I do have problems with them sometimes, but I talk to other people. I don't really directly tell them, okay, this is what happened, this is what so person did to me, and that. But sometimes I relate to other people. I say, okay, if a friend that does this and that, and what advice will you give this person that do this and that, and from that indirectly I get the emotional support I needed. And I think a lot of people can use that technique on themselves. If you are a reserved person that doesn't want to talk to people about your problems, I think that will help a lot.
Okay, as we wind down, can we as a family unit begin to be open to ourselves? If I can't tell my problems to somebody, I shouldn't take my problem to a friend or to a religious body or a religious leader or somebody outside. Can I talk to my family? My family, my own family, maybe my
is
parents,
important,
my
but
siblings.
dependent on your upbringing.
That's what I want to say.
Upbringing really plays
That's
a
what I
vital
want
role
to
here,
say.
because there are some families that are close naturally, there are some families that are distant naturally, and the way you were brought up, you understand. Maybe you are. I'm a kind of person that I'm close to my parents. There are a lot of people that I know that are not close to their parents. Some people, like, if you want that for your own children, you have to
Cultivate them.
Exactly.
Yeah.
It's not everything that you
Have to dish
scold.
out, yeah.
You scold a child on. You understand? Sometimes show them that, okay, this is wrong, but in a very polite way. Bring them closer to you so that they can talk to you, they can speak to you, they will have no problem in talking to you. They won't think, okay, if I tell my mom this, she's going to scold me, or she's going to beat me, or do this or that. Upbringing plays a vital role in sharing issues. You understand?
I lived in for some time now. I lived in a core northern state. I'm not trying to push this to a particular place, but the place,
You
local
don't need to
government.
mention it.
No,
Yeah.
okay. The local government that I lived, they have this culture of that mothers are actually like shy of speaking to their children about
Especially
some
firstborns.
issues, especially firstborns.
So treat it for our culture.
Yes. So
topic
what
of
I'm
our
trying to
program.
say is this: you can actually like be very close to your child, just like she said. So those upbringing, it actually matters when you have children that they can't even come close to you. Do you understand? So I grew up. I for one grew up in a home whereby I could actually easily go and just lie on my mother's leg, and then I'll just be like, okay, mommy, I'm going through this. I'll be crying and I'll be having like tears in my eyes and all that, and she'll be able to advise me. So it's easy for me and all that because the foundation has already been created.
Yes. And I think that works out for so many other people too. And but we are encouraging families, to open up, to be there for their family members.
Exactly.
And just because your son or your daughter gets married, and you don't check on them, you don't have one-on-one discussion with them. I remember something happened a couple of months back. A family friend of ours was sick. He was even in the emergency before his own senior brother even knew about it. The day he knew about it, the next day the man died. So, and I asked myself that this man has been going through depression for a very long time, and nobody knew about it. And my question is, the senior brother, you've not visited this guy for a while, and they live in the same environment. Maybe just Varimpa, for instance. It's not like you're staying in another state, and you can't even check, on your brother from time to time to find out exactly how he's doing, what exactly is happening to him. The guy quite already had marital issue, and nobody followed up until it became severe, and he now went to his death. Finally. So I think families need to open up. They need to be there
Supportive
for
emotionally.
It shouldn't be
and
until
then we
when you
should
call
break this
them.
barrier of, oh, you're a strong woman now, you can handle anything.
Yeah.
Oh, you are supposed to be a man, you should be able to handle everything. I think that's the barriers that we
One
need
thing
to
I
break.
should also say, men do cry. Nobody should tell a man
Yeah,
that you're not supposed to
No,
cry.
men do cry. Cry it
Please
out.
cry. Please
Cry like
cry.
a baby. Cry like a baby.
Men should cry.
You don't need to
please.
cry out loud in public.
But
But
why
you
in
should
your
cry.
restroom?
I
Or
feel
your bedroom.
that's one of the things that make women live longer, because
When you cry.
we cry, because when I cry,
So crying is a solution.
it's a
for
solution
depression.
for depression. Because when I cry, I feel much better.
Yeah.
I feel lighter when I cry. Sometimes when I cry, I even scream and wail. And by the end of the thing, yes, I
But
might.
you don't break the glasses.
No, I don't break the glasses.
Alright.
I wind up having a headache, but I feel lighter inside. So when I cry like that, I just feel
Okay.
lighter.
So
So I believe men should cry also.
Okay,
It
so
will
a
help.
remedy for depression: cry it out,
Talk it out, share it
Share
out,
it,
cry it
share
out,
it.
laugh, watch TikTok, watch Instagram, watch other social media. Just stay on social, not stay on your phone all the time, but stay on social media, watch comedies, funny things that will make you, even if you are sad, you feel light a bit.
And then you
Okay.
can also help.
Have good company.
The voices would also help on YouTube.
Yes, you follow us and we'll continue
Instagram,
the discussion
TikTok, everywhere.
Everywhere.
Yes.
Yes. And ladies, we just have to leave it here. We're totally out of time. I want to thank you very much for your time. It's a good topic. It's something we'll revisit again. And maybe someday we'll have a doctor talking to us about bipolar, so that we don't mistaken a simple medical issue for a spiritual problem that warrants beating and torturing of their victims. From all of us, it's bye for now.